Last month, a patient walked into my office. 58 years old, high blood pressure, exhausted every single day. His cardiologist told him his arteries looked like they belonged to a 70-year-old man. 3 months later, he came back. Same man, completely different energy. His arterial age? Dropped by 12 years. No new medications. No expensive supplements. He changed one thing: his breakfast. And today, I'll show you exactly what he did. I'm Dr. Lucia Mendez, physician specializing in clinical nutrition. And this story? It's not unique at all. Here's what most people don't understand about arterial health. Your arteries aren't just passive tubes carrying blood around. They're living tissue. They expand, they contract, they repair themselves. But only if you give them the right fuel. After 50, your arteries start to stiffen. It's called endothelial dysfunction. The inner lining stops working as well. Think of it like a garden hose. When it's new, it's flexible. Water flows easily. After years in the sun, it gets stiff, cracks appear, pressure drops. That's exactly what happens to your arteries without the right nutrition. The key player here is something called nitric oxide. Your arterial cells produce it naturally when you're young. Nitric oxide tells your arteries to relax and open up. More space equals better blood flow, lower blood pressure. But here's the problem. After 40, your body produces less and less nitric oxide every single year. This isn't your fault, it's biology. But you're not powerless here. There are foods that boost nitric oxide production naturally. Today I'm sharing 3 of them with you, all backed by clinical research, all realistic to add to your life. This isn't about perfection, it's about progress. Small changes that add up over weeks and months, not overnight miracles. Let me start with the first food, the one my patient added to his breakfast: pomegranate. Now I know what you're thinking. Pomegranate juice from the store, right? That's where most people go wrong. Store-bought juice is usually diluted, pasteurized, loaded with added sugar. You're getting maybe 20% actual pomegranate. The clinical trials that showed results? They used fresh pomegranate juice or whole fruit. Big difference. A study published in the American Journal of Cardiology followed patients with arterial narrowing for 3 months. Those who drank pomegranate juice daily showed 17% improvement in blood flow. 17% in 12 weeks. The magic compound here is called punicalagin. It's a potent antioxidant that protects your arterial lining from damage. It also stimulates your cells to produce more nitric oxide. Remember, that's the molecule that keeps arteries flexible. So how much do you actually need? The studies used about 100 milliliters of pure juice daily. That's roughly half a cup. Or if you prefer whole fruit, 1 medium pomegranate gives you the same benefit. My patient? He started blending fresh pomegranate seeds into his morning smoothie, 4 to 5 times per week. Not every single day. That's the beauty of this approach. It's flexible, it's forgiving, it fits real life. Now here's something important. Pomegranate can interact with certain medications, especially blood thinners and blood pressure drugs. Always, and I mean always, discuss this with your doctor before adding it to your routine, especially if you're on medication. The second food is probably sitting in your refrigerator right now: leafy greens. Spinach, arugula, kale, Swiss chard. You've heard they're healthy. But do you know why they're so powerful for your arteries specifically? Leafy greens are loaded with something called dietary nitrates. Not the same as nitrites in processed meat, completely different. Your body converts these nitrates into nitric oxide, the exact same molecule we talked about earlier. A study in the journal Hypertension found that just 1 cup of nitrate-rich greens daily lowered blood pressure significantly, within hours. Not weeks or months, hours. Because the nitrate to nitric oxide conversion happens fast in your body. Now I hear this concern a lot. What about oxalates? Don't leafy greens cause kidney stones? Here's the truth. If you have a history of calcium oxalate kidney stones, yes, talk to your doctor. But for most people, the benefits far outweigh the risks. And there's a simple solution. Rotate your greens. Don't eat spinach every single day. Mix it up. Monday spinach, Wednesday arugula, Friday kale. Different greens, different nutrient profiles. The target? 2 cups of leafy greens daily. That's raw measurement. If you cook them, they shrink down significantly. My favorite way? A big salad at lunch. Or sauté a bunch of greens with garlic as a dinner side. You can also blend them into smoothies. You won't taste spinach if you add berries and banana. One more thing about greens. The nitrate content varies. Arugula and spinach are highest. Lettuce, much lower. So if you're choosing greens specifically for arterial health, go for the darker, more bitter varieties. Now let's talk about the third food. This one surprises people every single time. Dark chocolate. Yes, chocolate can improve your arterial function. But before you run to the candy aisle, let me explain. Most chocolate bars are useless for this. We're talking about real dark chocolate, minimum 70% cacao. The active compounds are called flavanols. They're found in cacao beans. The more cacao, the more flavanols. A meta-analysis of 20 trials published in the Journal of Nutrition showed clear benefits. Dark chocolate improved endothelial function. Endothelial function is a fancy term for how well your arterial lining works. Better function equals better blood flow. The studies used about 20 grams daily. That's roughly 4 small squares of a standard chocolate bar. Timing matters too. The flavanol boost peaks about 2 hours after eating. So some people have it mid-morning. Now here's what you need to avoid. Milk chocolate. The milk binds to flavanols and blocks absorption. Also avoid Dutch processed or alkalized chocolate. The processing destroys most of the flavanols. Look for terms like raw cacao or minimally processed. Check the percentage. 70% minimum, 85% even better. My patient added this to his routine 5 times per week. 4 squares after breakfast with his pomegranate smoothie. He told me it felt like a treat, not a chore. That's crucial. Sustainable nutrition isn't about suffering. Now let me address the elephant in the room. Calories. Yes, chocolate has calories. About 120 per 20 grams. But we're not adding this on top of everything else. You swap something out. Maybe that afternoon cookie. The goal is net neutral calories, but vastly improved nutrient quality. That's how sustainable change happens. Here's something fascinating. When you combine these 3 foods, there's a synergistic effect. They work better together. Pomegranate protects your arterial lining. Greens provide nitrates for nitric oxide. Chocolate improves the function of arterial cells. It's like giving your arteries 3 different tools instead of just one. The research supports this layered approach. Let me be clear about realistic expectations. You won't feel different tomorrow. This isn't a quick fix. My patient started noticing changes around week 6. More energy, less afternoon fatigue, easier time with stairs. By week 12, his blood pressure had dropped 8 points. His doctor was impressed. So was I, honestly. But the real confirmation came from his arterial scan. That's when we saw the 12-year reversal in arterial age. Now I want to give you some practical implementation steps. Because knowing this information doesn't help if you don't use it. Week 1, just add one of these foods. Don't try all 3 at once. That's too much change too fast. Most people fail at nutrition changes because they go all in immediately, then burn out by day 5. Start with whichever food feels easiest. If you already buy spinach, double your portions. Add 2 cups to lunch. If you love chocolate, swap your current snack for 4 squares of 70% dark chocolate, 5 times per week. If you're adventurous with breakfast, try a pomegranate smoothie. Blend seeds with berries. It tastes amazing. Give that one food 2 full weeks. Let it become automatic. Then add the second food. By week 4 or 5, add the third food. Now you have all 3 working together in your system. This gradual approach feels manageable. Your brain doesn't rebel against small changes the way it fights radical overhauls. Let's talk about common obstacles. First one, cost. Pomegranates can be expensive, especially out of season. Solution: buy frozen pomegranate arils. They're picked at peak ripeness, flash frozen, and cost about half as much. You can also buy pomegranate concentrate and dilute it with water. Check the label, make sure there's no added sugar. Second obstacle, taste. Not everyone loves the bitter flavor of dark greens or high percentage dark chocolate. For greens, start with milder varieties like baby spinach. Mix them with sweeter ingredients like strawberries and balsamic vinegar. For chocolate, start at 70%. Let your taste buds adjust over a month, then move to 80%. Your palate adapts. Foods that taste bitter today will taste normal in a few weeks. I've seen this hundreds of times. Third obstacle, preparation time. If you're busy, the last thing you want is complicated recipes. Keep it simple. Pre-washed spinach goes straight from bag to salad. Frozen pomegranate arils need zero prep. Dark chocolate? Break off 4 squares, eat them. That's it. No recipe, no cooking, no cleanup. The foods I'm recommending are intentionally low effort, because I know you have a life outside of nutrition planning. Now let's address a critical question. What if you're already on blood pressure medication or blood thinners? This is non-negotiable. You must tell your doctor before adding these foods, especially pomegranate and dark chocolate. Pomegranate can enhance the effects of blood thinners. That's usually good, but your doctor needs to monitor you. Similarly, if these foods lower your blood pressure significantly, your medication dose might need adjustment. I've had patients whose doctors reduced their medication because their blood pressure improved so much. That's a good problem, but it has to be done under medical supervision. Never stop or change medication on your own. Let me share another patient story briefly. A woman in her early 60s, similar situation to the first patient. She was skeptical at first. She'd tried so many diets, so many supplements, nothing worked long term. I told her the same thing I'm telling you. This isn't a diet. You're not restricting, you're adding. She started with dark chocolate because she had a sweet tooth. 4 squares after lunch became her favorite part of the day. 2 weeks later, she added spinach to her morning eggs. Simple scramble, nothing fancy. Month 2, she discovered frozen pomegranate arils. Started sprinkling them on her yogurt every morning. 3 months in, her energy was completely different. She started walking again, something she'd stopped doing. 6 months later, her arterial ultrasound showed measurable improvement. Her cardiologist was genuinely surprised. She told me the secret was that it never felt like deprivation. She was adding foods she actually enjoyed. That's the philosophy behind this entire approach. Sustainable change comes from addition, not subtraction. Now I want to address something else. What about other foods people claim improve arterial health? You've probably heard about beets. Yes, beets are excellent. They're high in nitrates, just like leafy greens. If you prefer beets to spinach, absolutely use them. Roasted, juiced, however you like. Same mechanism, different vegetable. Berries also show benefits. Blueberries, strawberries, they contain anthocyanins that protect arterial walls. If you're already eating berries regularly, keep it up. They complement the 3 foods I focused on. Garlic gets mentioned a lot. The research is mixed. Some studies show modest benefits, others show minimal effect. I tell patients if you like garlic, use it. It won't hurt. But don't rely on it as your only intervention. Omega-3 fatty acids from fish are important too. Salmon, mackerel, sardines. They reduce inflammation in arterial walls. If you eat fish twice per week, that's excellent. It pairs well with the 3 foods we've discussed. The key is building a pattern, not obsessing over one magical ingredient. Nutrition works through consistency, not perfection. Let me give you a sample day. This is what my first patient's typical day looked like by month 3. Breakfast: pomegranate smoothie with frozen arils, banana, spinach, and almond milk. Takes 5 minutes to blend. Mid-morning snack: 4 squares of 80% dark chocolate with green tea. His favorite ritual. Lunch: large arugula salad with grilled chicken, cherry tomatoes, olive oil, lemon juice. Simple, filling, delicious. Dinner: baked salmon with roasted vegetables including beets. He rotated vegetables based on what was available. Evening: sometimes another small handful of pomegranate arils as dessert, or herbal tea. Nothing rigid. Notice what's happening here. He hit all 3 foods, but it's spread throughout the day naturally. He's not eating perfectly. Some days he skipped the smoothie. Some days he had pizza for dinner. Life happens. But overall, across the week, he averaged 5 to 6 days where he got all 3 foods. That's the target. 5 to 6 days per week. Not 7, not perfection. Just consistency with flexibility built in. Now let's talk timeline. When can you expect to feel or see changes? Week 1 to 2. Probably nothing noticeable. Your body is adjusting, cells are responding, but you won't feel it yet. Week 4 to 6. Some people notice more energy, especially in the afternoon, less of that 3 p.m. crash. Week 8 to 12. This is when blood pressure changes typically show up. If you're monitoring at home, watch for gradual drops. Month 4 to 6. Improved exercise tolerance. Stairs feel easier, walks feel less tiring. Circulation is genuinely better, beyond 6 months. This is when imaging studies like arterial ultrasounds show structural improvements. Measurable changes in arterial health. But here's what I want you to remember. Even if you don't feel different, changes are happening at the cellular level. Your endothelial cells are producing more nitric oxide. Your arterial walls are experiencing less oxidative stress. These are protective changes. They're reducing your risk of heart attack and stroke, even if you can't feel them happening. That's why I encourage people to stick with it, even through the weeks where nothing seems to be changing. Trust the process. Trust the research. This isn't pseudoscience. It's evidence-based nutrition applied to real life. Before we wrap up, I need to give you the standard medical disclaimer. I'm a physician, but I'm not your physician. Everything I've shared today is educational information, not personal medical advice. Your situation is unique. If you have existing heart disease, diabetes, kidney disease, or you're on multiple medications, talk to your doctor first. Show them this video if it helps. Most physicians will support evidence-based dietary changes, especially when research backs them up. Your health is a partnership between you and your medical team. Use this information as a starting point for conversation.